One of the greatest thinkers in history, Aristotle believed that music has a cathartic effect and it can keep negative emotions at bay. Plato also believed that music is the medicine of the soul. Is there better proof of music therapy than a lullaby that puts a baby to sleep? Hello everyone and welcome to the Navin Times Talk from the Heart. Music therapy has been there for a long time, and to talk about this we have with us today Dr. Margaret Lobo. She has been working tirelessly in this field to help people not just in the UK but also in India. Dr. Lobo, thank you for coming on our show and welcome.
Thank you very much. It's a great privilege to be here in the land of my husband, my late husband's family, and the people of Goa who are very dear to my heart.
Thank you, that's very sweet. Now, Dr. Lobo, we all speak about music therapy, but we speak about it rather loosely. However, I'm sure there is much more to it. Can you, in your own words, define music therapy to us?
Yes, I'd like to not be too technical about it because you can find anywhere on the internet what is music therapy, and it's very clearly defined. But I don't want to be scientific about the explanation of what it is, except to say that every creature, every human being in this world is related to music. And therefore, we are working with music therapy. We are fully qualified. We do an extremely fine training. My training was with the Guildhall School of Music in London. As a mature student, I started when I was 40, having worked for 20 years with corporates. And it was just opening up a whole new world for me. And through my own experiences with health, etc., I was able to say, this is where I belong. This is what I want to do. This is how I want to spend the rest of my life serving people. And that is using music as a therapeutic tool to help everybody. We are working in the UK, all over the world with music therapy, and it's vital that what we do here in India is give people the highest standard and quality of training to be a music therapist as we are capable of. And that's what I've been trying to do. So music is innate in every human being. We all love music. We are born with music. The first sound a child makes when entering the world is an ah. And therefore, right from the very beginning, we have sound, we have music with every human being. We are also working in India with music with animals, and I can always tell you more about that as the session goes on. But we use music through our own learning, through our own skills, and through those skills, through the excellent training that we do at our universities, we really begin to look at the whole psychology. How does music work? Who does it work with? What is it doing? How does it help? Now, this is all part of our training, and with this training, we learn to work in a very therapeutic, clinical way, which reaches the whole soul of music, the whole soul of each person we work with, and therefore our skills are united with the whole master of science of music, music throughout the world. And we don't differentiate between whether you're a certain culture, a certain age, a certain type, a certain color. a certain religion. We work with people from all walks of life, all ages, all humanity, and all creatures of well-being.
Right. So, Dr. Lobo, music in India, we have a very rich, vast culture of music, and we have, since ancient times, been using music as therapy. However, can you give us a brief history of music therapy the world over?
Music therapy the world over is trying to bring together people who really can have almost what you would call a full medical understanding, a scientific understanding, and a cultural understanding of how music can help people from all countries, all walks of life. Now, when I was invited to bring music therapy to India, because there hasn't been any specific training until recently, my husband, who was Goan, suggested we need to look at what does India have, because he was Indian and had a deep culture of India. What is it that India has, and what is it that we can offer? Now, we came to the conclusion the most important thing was to offer a scholastic training in clinical music therapy, using the elements that are so prominent in India. And we wanted something for India. We're not here to bring something from the West. We're here to bring our knowledge and see how we can infiltrate our knowledge with the great, great knowledge of India. And so on our training program, we have set up a very strong training in Ayurveda, training in Hindustani music and other India classical music. We also have creative movement, which is very important, particularly when working with children or adults who have great difficulties recovering the ability to move freely. And we have also got a lot of psychology, psychiatry. We're very, very versed in mental health, which is a very important issue.
Especially now.
Yes, especially now. That it is vital that we reach the people who are otherwise undiagnosed with a severe condition or a normal condition such as mental health, depression, anxiety. We need to help these people right away.
Right.
Now, India has thousands of years of history and science that there is not existing anywhere else in the world at all. And my husband and I have studied the Vedas for over 30 years. We have also studied Sanskrit, and now we have been practicing yoga and Ayurveda for over 25 years. And with Dr. Neelish Korde and Dr. Gaurav Desai, and the knowledge that that has brought to our work here in India is very important. We're not here to tell India, this is what we can do, this is what you need. We're here to say to India, we want to unite with the importance of yoga, the importance of Ayurveda, the importance of the science of music. And one thing that has opened my mind so much is that Ayurveda, if you look up, knew about autism hundreds of years ago. They knew about music, helping to bring people a better quality of life who have come out of a coma. Mm-hmm. You know, the history of this country is so important, and that's why we wanted ours to be an Indian program for India, but based on the great knowledge and experience of the West.
All right. So you have spoken about the different fields like psychiatry, psychology, yoga, Ayurveda, and the other sciences that you have said you include in your music therapy. Now, who are the people who, you have even spoken about animals, but let's speak about people. So who are the people who benefit most from this therapy?
I wouldn't use the word most. I would say it's for everybody. There is no discrimination when we work with someone. We are totally there in the present moment with our experience to offer what we can do. And therefore, the training we've had is an on-hands training as well as working in the classroom. And you do a lot of internship. The courses are quite demanding. Our program in India at the moment is 1 full year, and that program really covers a lot of psychology, psychiatry, and mental health, so that you have the experience from the beginning to work with patients and then to have supervision from your course tutor to guide you through what you're experiencing, what you're finding yourself. We also have self-help groups, where as a group of students working together, you would learn improvisation together. You do not have to be a brilliant musician, but you have to have a love of music, a knowledge of music, what it might be able to do, and also to really, to do this work, you have to have the love in you, because it's very important that when you're working with a client, you don't look at just the condition, you look at the whole person. And when I made a sankalpa right from the beginning, that from the first client 40 years ago, if I ever worked with a client and didn't see the same self, then I would quit. Because you cannot have duality. You have to have equality. And therefore, I have worked with people from all ages, all levels, from a child, from a mother who's expecting a child, working with Sanskrit sounding to make sure the healing begins already in the womb. You then work with people. My love at the moment very much is working with dementia and working with people who are isolated, living alone, particularly the need in Goa, where so many young people have had to go abroad to get jobs, to get employment, and their parents are left behind. They see them maybe once a year, but what happens is as the parent gets older and older and dementia comes in, there's nothing worse in life than loneliness.
It is.
And these people need company. They need family around them. And when we start groups of music, as we have done here with a wonderful organization called Cooch here in Goa, one of our trainees who is now qualified, Mr. Russell Cardozo, he's a wonderful man from Goa who wants to bring all of this work to Goa with our help.
Right.
And he has been working with elderly people as his internship with Cooch, and really shows the love. The moment you introduce music again to these elderly people, they are alive. They remember every word of a song. They want to get up, they want to move, they want to dance, they want to talk. what you're reaching is right to the core of what we all are. We are all musicians. We're born with music. We're born with rhythm. And how it's given to us throughout our life, how we follow it, is so important.
It is. Now, you spoke about loneliness, and you said, as people grow older, as we grow older,
Yes.
Especially the senior most, and their family members are not there, loneliness creeps in. But Dr. Lobo, today loneliness is a very major illness that is everywhere. Everywhere we turn, there is loneliness. And I'm sure there are some viewers right now who are sitting and are lonely. So I think music therapy today is very universal.
Yes.
And I think we are all in need, at some point of time, we are all in need of this therapy. Youngsters, the youth, are so into music.
Yes.
Dr. Lobo, they have their earphones, and they are listening to music all the time. How can we empower our youth to use music and to use music therapy, not only for their own benefit, but how could they help and reach out to others?
I think if we can now bring this work more to schools and to colleges and to universities and work with these young people in groups. We have some wonderful programs that we use. One is in guiding in imagery and using music. One is improvisation. You see, you have a lot of young people loving music, but they don't know how themselves, whether they can play. Oh, I can't do this, I can't do that. We show them the most important thing we can do is to share music with others. Now, you look at young people going to a music event that's on, they become so alive, so happy, so confident. We have started drum circles with young people, and those young people, I tell you, they just get into it right away. It's so natural, but we never impose on anybody. It's not about imposing. We never judge anybody. But the most important thing is we also learn how to communicate with each other through music, through rhythm. But we also need to use it to help these young people build their confidence, self-esteem. There is a great lack of technology work here for young people. They need support. This is our future, and our wish is to work a lot with young people, and where else but Goa. I mean, it's needed everywhere in the world, and we are doing it, but my God, we really want it here, because you've got a culture here in Goa, and I'm so proud to be a part of it. I'm staying with my ex-husband's lovely family, and with our Ayurvedic doctors and their families, and the warmth and the care, but the love of their tradition is very strong, and the love of music, the love of their culture, the love of their prayers, the love of the family. My goodness, having been in the West for all these years and coming and living in Goa, I just see something that the West is actually now wanting to get back to.
Right.
And that is the love of sharing and giving. And that's what music does. It immediately wants you to offer. And that's why we're here.
Right. And like you rightly said, we Goans love music. I think, in our fiber, we have music, we have rhythm, and our youth, as you have rightly said, there are today the number of children, the number of youth that are going for music classes, are learning music, even online. The number is rising every single day.
Yes, isn't that wonderful?
Especially the pandemic and the post-pandemic.
Yes.
It has had a good effect and a bad effect. I mean, there are two sides of the coin. But yes, music is a part of our fiber. Now, if I were, you spoke about, therapists who need to have love for music. But if I were a patient and I come to you and I say, I don't know, I can't sing, not even to save my life, and I don't know how to play any instrument, how can you help me? So do I need to have music for you to help me out?
Not at all. In fact, I have worked with people who had lost, through strokes, had lost the ability to use their voice. I was one of them twice, so I know what it's like when you feel you can't join in, you can't participate.
Right.
And we would never, ever force that on somebody. What we use a lot in music therapy is writing our own song. And we can encourage a person who has speech or is beginning to speak, or we can help them speak, and we can say to them, let's start with one word. Yesterday. Now, the Beatles wrote a song called Yesterday, and look what came from it. So you start with one word, and then you start with another word, and then you start with another word, and before you know it, you have actually created a poem. Now, whether it rhymes or not doesn't matter, but you have written something from your own ability, your heart, and it starts to come alive when you put it to music. So our therapist would sit down, maybe with the guitar or the keyboard or just the voice, and would start to strum a sort of very simple rhythm, very simple, putting the words to the rhythm. Now, I did this recently with the most wonderful man in Delhi over the phone. He had had a brain hemorrhage, lost his ability to speak, had had a lot of therapy, was making progress, but his whole being wasn't progressing. And I got him to gradually, through a lot of work that I do with sound and Sanskrit, and exercising the breath, we began to get sound coming. This man began with physiotherapy. He began to be able to move again and gradually to walk. Now, from a man who couldn't even say his name, he is now back to work with the corporate that he started with.
That's amazing.
So you do it step by step. You work with the person. You don't work yourself and trying to make the person better. It is something that you join together with, you are united with, and therefore you're growing as a team already. You're not growing as me on my own. And having that support, whether you're someone with dementia, which is a work that I am pioneering a lot, I hope, here in Goa, because I just love working now that I am myself very old. I love working with people who feel in a way that they're locked in and locked out, that they're not needed in society anymore. I'm just finding that these people have had such a life. They have so much to offer. And a group I worked with in London, we got them to tell gradually, if they could speak, we would help them write their own story. And at the end of it, they were doing everything. They were doing art, they were bread making, they were doing things that everybody told them they could not do. And I had a group of mothers with children with disability. And we sat down on the floor one day, and I said, I want one word from each one of you. And that one word we would write down. And then I said, now we're going to write our own song. And there were about 24 of us. We wrote our own words out as we would, just in sentences. We got our music therapy to sit with the women and start putting it to music. And then they would say, no, we don't like that there. We think you should do this. So they were in control. We weren't.
Right.
And at the end, they performed that song 2 months later at one of our charity Christmas concerts to over 200 people. And got standing applause.
Wow.
Now those women are coping every day of their lives with great difficulties. The most important thing when you have a child or a parent who needs support, the most important thing is that we try to be there for them.
Right.
And they're included. And to see people begin to find their true self again, to live again, I think that's the whole purpose of the work that we do, and the whole purpose of bringing it to India. We are not here to say, you are Hindu, you are Muslim, you are Catholic, whatever it is. We are here to say we are all one, and we have unity through music. And if we get a musician, as I have many times, who has had a stroke, has been in coma, and when you help them out of the coma and they're ready to get back to their music comes from a different place now. It comes from total experience of what it's like to rediscover that soul within you, which is music, which is innate in every human being.
Right. So, like you rightly said, music and music therapy is all about collaboration. It isn't about just the therapist. It is how the therapist works with the patient, with the client, with the person, and then produces something very beautiful, very unique. Am I right?
Absolutely. Now, they might not produce something that is very beautiful.
It may not be beautiful for us, but in that person's eyes, in their perspective, it definitely is beautiful.
And you see the difference. I've had people who could not walk. I had one lady who Dr. Korda witnessed, and it transformed his thinking, because in Ayurveda, the closeness between music and Ayurveda is total unity, and the same with yoga, the same with Sanskrit. You know, when I use Sanskrit vowels and some Sanskrit words, or we perhaps go through parts of the Gita singing it on just one note, the difference it makes to people is totally amazing. Now, you won't get that anywhere else but India.
Absolutely.
Because it's in the India culture. It's so wonderful to see how the culture of yoga and music and science have been really recognized throughout the world. And I said, when the first day I was asked to bring this work to India, I remember saying to myself, this is India. India will lead the world in music therapy because it's already there.
Absolutely.
You've got thousands of years of history, of science, of knowledge from the greatest minds in the world. I brought a lot of that to London, because we lived in London half of the year in India, particularly Goa. And you know, the appreciation of people wanting to know more about the whole science of the arts is quite amazing. And they're longing for it over there. And if we can make India the best example of music
and
therapy,
the
center of music therapy, that would be wonderful.
Absolutely.
So that's where we're at, and I hope I have a few more years to do it.
I'm sure you do. Okay, it's time for a short break. We will be back soon. Don't go anywhere. Welcome back. We are in conversation with Dr. Margaret Lobo, who has been doing some exceptional work in the field of music therapy in UK and in India. So, Dr. Lobo, you have been giving us so much of information. Now, can you tell us how is sound therapy different from music therapy?
I don't know. I wouldn't like to say it's different, because we're all after the same love of our work, the same hope that it is working to help people. But I think we have to be very careful that we don't lose out on the actual training of mental health issues in particular. How do you work with an autistic child who is extremely anxious? And you can go in and play a raga, which is absolutely brilliant, and that child will calm down. But where is the development? You need to take step by step by step, and with that development you will see a child grow, and you will see the anxiety lessen, and you will see the child begin to display an active part in communication with the therapist. It's all about having that unity between the therapist and the client, not just allowing them to sit and listen, but participate, because by participating we grow. When you're a child and you're in school and you're learning to write, the teacher will show you how to use the pencil, how to use colors, how to use different things, and guide you step by step. Now, in music therapy, we would look at the child from day one, and then we would start to build a program specially for that child, and build that program around the child's ability. We would never impose, never say do this, do that. We would build it around the developmental needs of that child, and that is the excellence of our training. Any doctor who has trained with us, or has actually observed our work, or has had written proof of the work that we have done, who has observed a child who has worked with us over the time period, they will see from the notes we keep, from the development program we have planned, they will see that this child went from step 1 to step 5 to step 10. We in London, if I could speak about that, my husband and I started our center in music therapy in London. We had nowhere to work, no money, but we took out a mortgage and built a music therapy center ourselves. And that meant that people could come. Now, because our community had nothing in our area,
Right.
that people could say, go there for your help. So when we built the studio and I did my first day of teaching, I had 2 small autistic children to work with. And when I finished that day, I went into the house and I burst into tears, and I said, we've done all of this, spent every penny we have, we're mortgaged to the hilt, and we have 2 children. And he just looked at me quietly and said, it will come. We provided the premise. You're trained. It will all be given. And now we started with 2, and we worked up to the point of having over 270 children a week coming
Wow.
to our center. Now that, you would say, is impossible when we've only had 1 big room.
Right.
But it was groups. And one program which I love and would love to work with young people here with, and so would Mr. Cordozo, is that we worked with groups of young people. They were unemployed, living at home, not going out of the house, not sharing with others, and became completely isolated. Now, one family, both parents were doctors. They had a bright son. He was a musician, but he dropped out of college. They were quite into a scene then, if they did go out, of getting into drugs and crime. And so the council, the government, rang and said, how can you do something for these young people? And with my therapists, I sat down and we put a program together. And we had right away 27 children come. Now those children had to be given a carer to come along.
Yes.
And they all came the first day, one by one with their carer. By the end of the sessions, they were all leaving together as a group. And the boy who wouldn't go out of the house, he was a musician. He started to play again. He played the trumpet, and he started to show the others how to play the trumpet. They started sharing their drum circle playing. They started sharing their singing. They wrote their own songs, and by 4 months later, by Christmas, they performed at our Christmas concert, and they sang their own songs that they themselves together as a group had written with the help of the therapist. So, I mean, I could go on a whole day talking about
I'm sure.
40 years of work.
I'm sure.
I just think it is so vital that if we can now start to train more young people to become music therapists, or to have training on courses where they can take that to build their confidence, and then they can also take it if they get employed. They can take that to their employment. You know, they can offer it to others. And I'm not saying they're going to go in and do music with them, but they have the inner confidence now to show leadership. And that is so important. And when they show leadership to people of their own age and confidence, my goodness, what a blessing to have.
It is.
So I don't want to limit music therapy to just this or that or you and them. It really is important now that we focus very much on mental health because of COVID, and governments in all over the world are trying to do that because they see how this has really been detrimental to the whole of society. But I think we have to really look at how the young can benefit from the workshops that we do, which use movement, which use sound, which use improvisation. And it's very creative, but it is very structured. And that's what they learn from. They
Right.
want guidance. And I think the use of music as a therapeutic tool. Now, when we're setting up workshops, I don't, in some cases, I don't call it music therapy workshop, because the moment you mention therapy, people get scared. I don't need therapy. So we call it music as therapy, or music as a therapeutic tool. And therefore, they're looking like I started in London over 30 years ago, what we call music club, where we could see how people with disabilities had developed. And we started to build, with our therapist, a music club where all of these young people could come together once a week and start talking, sharing, talking about if they could talk, but feeling a part of a group, because a lot of these children with disability are very lonely. They're made fun of, they're bullied. I had one young girl who has muscular dystrophy, lovely Indian girl in London, full of determination to do something with her life and intelligence, and they would push her down at school knowing she couldn't get up. And she would sometimes sit in the hallway of the school for 2 hours until somebody came to get
help
her. I had one young boy, also an Indian boy in London, where when he went to school and he never told his mother, he would walk through a tunnel to go to the other side of the road. The gang of boys would be there for him, and they would put cigarette butts out on his skin. And he never told his mother because he was ashamed. And one day she saw him take off his shirt, and she saw these big scars
marks, yeah.
on his body, and she was horrified. And so she reported it to the school, and the school made sure there was a guard there to watch these children come in. I mean, a lot of these children have discovered the most, they've been through so much. And the moment they're together as a group making music, accepted, they're making friends.
Absolutely.
And so the music club now, they became so wonderful with their music that they do about 4 concerts a year. And not only that, but we thought with our therapist in London, why don't we put them forward for music exams? So we set up classes with these children who wanted to do it, and we set up classes training these children how to read music. They don't know how to read music. A lot of them can't read, but they can read music. So we taught them how to read music, how to count, how to answer the questions that they would be asked, what is music, etc. And we began entering them at the Royal College of Music in London for their music exam, general music.
Right.
And now we have over 74 children who have graduated with their certificates of the year that they've taken. We have some children who got complete distinction. They are now performing, they're making friends, they've got a band, and still after 20 years, they are now meeting every week, and they play beautifully. And they don't just play Twinkle, Twinkle, Little Star. They play Latin American music, jazz, everything. And I mean, if I can say in my life that to have seen this grow, what a privilege. You know, to see, when I go back from India and meet these young people again, watch them rehearse, watch how they've grown. They are very confident young people. Very confident, very happy. They've got friends. Some of them are now going to get married, you know, which would have been unthinkable a year ago. 2 couples are going to get married. And, you know, meeting them, they just come to you and embrace you with love. And that's what we need with our young people. Let them embrace us all with love. That's what we need in the world. We've had enough greed, enough
grief.
Grief. Yeah, thank you. Because grief is also a very important work for music therapy.
And there's so much of grief around. You know, it's on the rise. But however, Dr. Lobo, like you have said, and I'm sure the viewers agree with me, that there is a time for everything. And, you know, in church we sing the hymn, in his time.
Yes.
In his time. So when the student is ready, I truly believe that the guru appears, that the teacher appears. And this conversation, I hope, is going to be an eye-opener, especially to our youth, especially to our Goan youth who are hopefully listening or watching, that you have so much of potential in you. As Goans, we have music in our, you know, it is interwoven in our fiber. And if we can use it for the benefit, not only of ourselves, but for others, I say, why not?
Yes.
Right?
Yes.
Why not? Now, we have just time for 1 or 2 more questions. So, Dr. Lobo, can you tell me, if I would like to be a music therapist, what are the requirements?
Well, what we've done is we've introduced some short-term courses because we've been working with groups of teachers, groups of doctors, groups of psychologists, physiotherapists, each individual program catered around that person's need and what their profession is, to give them a further tool to use in their work. Because when you're working with a physiotherapist, when you add music, the work speeds up.
Right.
You get better quicker. Now, because I had to twice learn to walk and talk again, when there was no music around, it was a long, painful process. But now, when I look back, I had a stroke 4 years ago, couldn't speak, couldn't walk. I knew how to help myself. So we're looking at the fact we're preparing ourselves in how to work, how to get ourselves moving. Now, when I was in the ambulance and I couldn't speak, I kept chanting Sanskrit prayers all the way in the ambulance. And I did that through the whole night in my mind. And the next day, my first words came. And they couldn't believe it because I had a speech therapist there. So for the 4 days I was there, the speech therapist kept coming in. Can I speak to you? Can I work with you? How do you do this? I have speech therapists come to my sessions with a client because they want to know, what am I not doing? Because they don't work enough with the breath. They don't work enough with the support of the voice. You have to use sounding and breath united to begin to learn to speak again. And then I use rhythm. So, for instance, with stammering, I've had people come who stammered so badly they couldn't say a sentence. Afterwards, they would be reading Shakespeare poetry, walking up and down the room, and they return to not total normal speech, but my goodness, 100% better.
So what you're saying basically is, if I come to the school and I want to be a music therapist, do you look at which area I'm going to be working in? And then accordingly train me. Is that what you're saying?
That is wonderful. The training is the same for the whole group.
All right.
So that you are all covered in the necessity to know how to handle
So there's a
the
basic
work.
module.
There is a very important module that you follow.
Right.
But when it comes to internship, if you wanted to do and you had been accepted to do the full course, then you might say, I want to work with children.
Right.
Like one of our therapists worked with Cancer Care Hospital in Delhi with children for a whole 6 months internship. And therefore, you might say, I only want to work with the elderly. I don't want to work as a music therapist, but I want to use what I've learned in my corporate work. We also have done work where we go into corporates and we get the group communicating, because sometimes you're at a desk, you do your job. I worked for a top corporate for 20 years, so I know. And you might have somebody you're upset with or angry with. You have learned how to communicate that, how to share it, rather than hiding away and getting frustrated and angry. And I have had groups, particularly young men in Delhi, phone me and say, we don't want to just do yoga, we want to do something creative. How can you help us? So we set up a creative program for groups of young people, men and women, which included yoga, Sanskrit, sounding, music therapy, improvisation, and it's so needed. But we are a small organization still. We're growing all the time. Last year we trained 9 more clinical music therapists who are going to be working throughout India. We have trained over 41 throughout India. We also are doing online programs to people who are not able to come to the center and do the work. We will do a specific online program for them. but you do have to have an ability to take on board the knowledge that you're being given. You are given knowledge that a doctor is given. In fact, you can really sit, as I have, with a few doctors, and the Ayurveda doctors understand, because they understand the history of music and the importance in Ayurveda. But you know, you doctors are now coming to us saying, I'm stressed. Look at what we've had to cope with. How can you help me so I can help my patients? It's really very, very important.
I'm sure it is. So, if you would like to give a message to our viewers and tell them how important music is, how it can help them as a therapy, what would you like to say to our viewers?
I would like to say join us because it's very important you have guidance. Now, during the COVID breakdown and everything, we did a lot of programs online, and we did a lot with going into people's homes on Skype and getting groups together, and particularly people who were locked in the home. And so I think to feel, well, I'm also isolated here on my own, I can't come to you, so how can I possibly do this? I think we need to have people come to us, ask us what they need, and then we can help find the need. So I think it's our duty to say, I've never turned anybody away. In over 40 years, I've never said I can't. I've never said no. And I think it's very important that when you are at home on your own and you're stressed or you're lonely, you're very anxious, suffering from depression, that you find a way of just sitting down a few minutes every day, putting on music that you want to hear. The program I use is allowing people to bring to me copies of their own music, and then I introduce copies of my own music, and then we do mandala work together, which they then show what was in their mind when they listened to their music, and what is in their mind when they listened to what I had chosen. And it really was wonderful to see the transformation in that experiment. It was wonderful. So we need to reach out to people. We need funding. We need support by schools, by doctors, and we can go and speak to them. And because people are skeptical. Here comes another thing. When people say, well, how does it differ, as you asked me, between sound therapy, etc., I think you have to look. If you were a doctor, you want to send people who are going to research what is being done, who are going to make very clear, constructive notation of what they're doing in their work, and they feed it back to the physiotherapist or the doctor. We also, which I haven't mentioned, we work also with the parent, because you might have parents where they have a severely autistic child, or a parent who has dementia. We've worked with carers who go into care homes, who are working in hospitals, in day centers. We have trained those carers how to find ways to cope with the work that you're doing, because it's very stressful.
It is.
And they have gone through special training with us. If a person, for instance, has great difficulty eating, how do you can't force them, but you can't let them starve. Now, if you know that person has a particular love of music, and a particular music, because the family, you are working with the family, then you introduce the music, and the person is focusing on the music and less on their fear of eating. So you've always got to be looking at the tools you can use through your experience, but through the excellence of your training. also, I'd like to mention that what is wonderful in India is the different languages. And we always, when I used to go around Gujarat, Bilaspur, different places giving talks, I always had a translator who could translate into the language. If we have students who are having trouble because the course is partly in English, apart from our local tutors, Indian tutors, then we are there to help that person through, because that person is going to be working with their own people, and it's important they feel comfortable doing it in their own language. So it's vital. This is for India.
Right. But Dr. Lobo, music has its own language. It's a universal language, and it can benefit not just me and Dr. Lobo and some of her clients, but you as well, and everyone. So we need to take that music out. We need to help others. And this brings us to the end of our talk. It has been an eye-opener.
Thank you.
And thank you so much on behalf of the viewers, on behalf of Goa 365 channel, and of course the Navin Times. Thank you so much, Doctor. We hope to see you again.
Thank you.
And we wish you all the very best.
Bless your heart. Thank you very much, and thank you everybody. Bless you for listening. Thank you.
And to all our viewers, thanks for your time and your attention. And until next time, take care of yourself.